Continuing on Unit 9 on nutrition. Nutrition is the taking in and using of food by the body to maintain health. Basic nutrition, the most essential, of course, is water. We cannot live without water for very long. Fats are another nutrient. They are a source of energy and they add flavor. Carbohydrates produce energy and fiber. Proteins are used for tissue growth and repair. So sometimes after a major accident or surgery, they'll have patients on a high protein diet to promote healing. Vitamins help maintain body functions, and minerals help the body function normally. Special diets are ordered for residents who have certain illnesses or conditions. Clear liquid is fluids that you can see through. They are liquid at room temperature. Full liquid are clear liquids with the addition of cream soups, milk, and ice cream. So you can't see through them on a full liquid necessarily. Liquid diets may be ordered for residents with nausea and vomiting before or after surgery. A mechanical soft diet is foods with a soft texture, easy to chew and swallow. They will have ground meat, no raw fruits or vegetables, and it's used for residents with dental problems or no teeth. Pureed is food that is blended. It's used for residents who have difficulty chewing and swallowing. Low sodium is salt is restricted. No salt shakers or salt packets on their meal tray. Condiments with high salt content is restricted. It's used for residents with heart disease, high blood pressure, and kidney disease. A diabetic diet, calories, carbohydrates, protein, and fat are carefully calculated. They must eat the right amount of food at the correct time. This includes meals and snacks. Dietitian works closely with the resident. Thickened liquids. Thickening agents added to the liquids used for residents with swallowing problems. It decreases the risk of choking and aspiration. Desired consistency, the doctor will order, or the speech person sometimes is the one who takes care of this because they do the swallowing evaluations, and they will say thickened liquids, nectar consistency, honey consistency, or spoon thick, and that how it's ordered is determines how much you put in the water. Dysphagia means difficulty swallowing. That seems like that's always a test question. Serving meal trays guidelines, you should wash your hands. They will all have a diet card with their food tray, and make sure that you're giving it to the correct resident. Only do what the resident cannot do for themselves. So, clothing protector, that's what we call it. We do not call it a bib. If it is the resident's choice whether or not to use a clothing protector. Feeding a resident, you're going to wash your hands, maintain face-to-face contact whenever possible, offer food and fluids according to the resident's preference. Small bite-sized pieces, offer liquids throughout the meal, make sure the mouth is empty before you give the next bite, talk to the resident during the meal. If you are helping to feed somebody who is blind, you're going to use the face of a clock to describe the location of food. So on this, you would say peas and carrots are at 3 o'clock. Observe and report any swallowing problems to the nurse immediately, and document food and fluid intake according to the facility problem. A lot of times what they do is on their diet card, they'll write 50%, 75%, 100%, what they ate. Resident rights, they have the right to refuse food and drink. They have the right to ask for and receive different kinds of food. And so usually there's this option, secondary option, if they don't want it being served to everybody. And report this to the nurse if they tell you one of these things. Nourishments may be ordered for a specific time and amount. An example, the diabetic will have snacks ordered. Somebody who's malnourished, we may have supplements like Ensure ordered, or they have something called Mighty Shakes that they give them. Needs to be delivered to the resident when ordered. Notify nurse immediately if the resident does not eat their snack. Tube feedings, used when a resident has difficulty or is unable to swallow. A nasogastric tube inserted through the nose and esophagus and into the stomach. You can see that where the tube has gone in through the nose and is stopped in the stomach there. This is a G tube where they've made a hole in the actual abdominal wall and the tube is straight into the stomach, so they don't have to have it down their nose. And this is for somebody who's going to be on tube feedings for a long time. They would do an NG tube if it's just short term, and they would do a G tube is what they call it if it's long term. A tube feeding given with a syringe. So sometimes, this is an example, you guys don't do this as a CNA, but tube feeding per gravity, that's what that looks like. They just pour it into a syringe. The nursing assistant's role in tube feeding is to notify the nurse immediately if they have any trouble breathing, if they're vomiting, or they have any abdominal distension or signs of aspiration. And that's that.